Quality Control of Semisolids, Taiba University College of Pharmacy. Contents: 1. Introduction on semisolids. 2. Semisolids composition and characteristics. 3. Application and considerations. 4. Importance of QC tests. 5. QC tests for raw materials. 6. QC tests for in-process and finished products. Introduction. Topical medications are a crucial category in pharmaceuticals, encompassing treatments applied to the skin's surface. The skin serves as a vital route for drug administration due to its accessibility and ability to target localized issues. Topicals are utilized to treat a wide range of skin conditions, from acne and eczema to pain relief and wound healing. Ointments. Composition and characteristics. 1. Ointments are semi-solid preparations, primarily composed of an oily base and active ingredients. Key components include a base, such as petrolatum or lanolin, and pharmacologically active compounds. 2. Ointments offer advantages like prolonged drug release, but can be greasy and less cosmetically appealing. 3 common examples include antibiotic ointments like Neosporin and corticosteroid ointments for inflammation. Creams. Composition and characteristics. 1. Creams are semi-solid emulsions, often categorized as water in oil or oil in water. Their composition involves water, oil, and emulsifying agents, providing a balanced texture. 2. Creams are favored for their versatility, as they are less greasy than ointments and absorb easily. 3. Common creams include moisturizing creams, hydrocortisone creams, and antifungal creams like Lotramine. Application and considerations. Proper application techniques are crucial to ensure efficacy and safety when using topical medications. Storage conditions and shelf life should be adhered to, as improper storage can lead to degradation of active ingredients. Regulatory considerations include adherence to pharmaceutical guidelines and labeling requirements for manufacturing and marketing these products. Importance of quality control tests. Quality control tests are crucial in pharmaceuticals to ensure safety, efficacy, and consistency. They verify product safety, active ingredient concentration, batch consistency, and shelf life stability. Regulatory compliance with agencies like the FDA relies on these tests. Tests include assays, microbiological checks, and stability assessments at various production stages. Quality control tests of raw materials. 1. Visual inspection. Principle: a method to detect and evaluate visible defects and irregularities in raw materials. Procedure: 1. Examine the raw material under appropriate lighting conditions. 2. Check for impurities, discolorations, foreign particles, or any other visible defects. 3. Compare the appearance with established standards or reference samples. 4. Document any deviations or defects observed. 2. Identification principle. IR identifies compounds based on their specific molecular vibrations when exposed to infrared radiation. Procedure: place a small sample of the raw material on the IR spectrometer's sample holder. Scan to obtain the infrared spectrum and compare it with known reference spectra of the desired raw material. 3. Assay principle. Assays determine the quantity of the main component in the raw material, often using spectrophotometric methods. Procedure: prepare a standard solution of the known compound. Similarly, prepare a solution of the raw material. Perform spectrophotometric analysis to determine the concentration of the active component in the raw material. 4. Impurity test. Principle: separation techniques like HPLC or gas chromatography are used to detect and quantify impurities in raw materials. Procedure: inject a prepared sample of the raw material into an HPLC or gas chromatography system. Monitor the output chromatogram to identify and quantify any peaks other than the main component. 5. Particle size distribution principle. Sieving separates particles by size using meshed screens. Procedure. 1. Stack sieves in decreasing mesh size order with a collection pan at the bottom. 2. Place a known weight of the sample on the top sieve. 3. Shake sieves using a mechanical shaker for a set duration. 4. Weigh the material retained on each sieve. 5. Calculate the percentage distribution based on retained weights. Quality control tests of in-process and finished products. 1. Physical properties. Physical appearance. Key features to check. Color change. Crystal growth. Cracking of creams. Marked change in viscosity. Development of lumpy and granular appearance. Factors affecting physical appearance. Temperature. Incompatibility. Microbial growth. Packaging. 2. Dissolution test. Principle. Dissolution testing evaluates how effectively the active ingredients are released from the product, affecting bioavailability. Procedure. The product is introduced into a dissolution apparatus, and the release of the active ingredient is measured over time, often using UV spectroscopy. 3. Solubility. Principle. Solubility tests in pharmaceuticals gauge a drug's dissolution capacity in a specific solvent, influencing drug formulation and bioavailability. Procedure. 1. Weigh the drug. 2. Select the appropriate solvent. 3. Dissolve drug with agitation. 4. Allow equilibrium. 5. Filter out undissolved drug. 6. Analyze filtrates drug concentration. 7. Calculate solubility. 4. Stability. Test principle. Stability. Testing assesses how the product performs under different storage conditions to predict its shelf life and ensure it remains effective. Procedure. Multiple samples of the product are stored at different temperatures and humidity levels. The samples are periodically analyzed for changes in appearance, content, and performance. 5. Sterility test principle. Sterility testing verifies the absence of viable microorganisms in pharmaceutical products. Procedure. 1. Prepare the product sample. 2. Inoculate into specific media. 3. Incubate at set temperatures for 14 days. 4. Examine for microbial growth. 5. Use controls to validate results. 6. No growth indicates product sterility. 6. Content uniformity. Test. The net weight of contents of 10 filled cream containers is determined. The results should match with each other and with the labeled quantity. This test is also called minimum fill test. Net content, just total weight. Weight of empty tube. Calculate the average weight of content. Weight of 10 tubes, 10. Principle. The content uniformity test aims to determine the consistency of the active ingredient's content in different samples taken from a batch of cream or ointment. It ensures that each unit or dose of the product contains the specified amount of the active ingredient, providing consistent efficacy and therapeutic effect. Procedure. 1. Take a representative sample of the cream or ointment batch. 2. Extract the active ingredient from the sample using a suitable solvent. 3. Analyze the extracted sample using an appropriate analytical method, e.g., HPLC or GC, to quantify the active ingredient. 4. Randomly select a specific number of units or doses from the batch for testing. 5. Determine the acceptance criteria for the active ingredient's content based on regulations or specifications. 6. Calculate the mean and standard deviation of the active ingredient's content for the tested units. 7. Compare the individual results against the acceptance criteria to assess content uniformity. 8. Perform statistical analysis, such as calculating the coefficient of variation, CV, to evaluate variation among the tested units. 9. Document the testing procedure, results, and any observations in a report. 7. Test for rate of absorption creams are those from which the drug initially moves into the deeper skin tissues and finally into the systemic circulation. Such creams should be evaluated for the rate of drug absorption. The cream is applied over a definite area of the skin, and at regular intervals of time, serum and urine samples are analyzed for the quantity of drug absorbed. Principle: the test measures the rate of absorption of the cream or ointment by monitoring the amount of the active ingredient that permeates through the skin over a specific time period. The rate of absorption provides information about the product's ability to penetrate the skin and deliver the active ingredient. Procedure: 1. Prepare the skin by cleaning and drying it. 2. Apply a measured amount of the cream or ointment to the skin. 3. If applicable, use occlusive material according to instructions. 4. Collect samples from the skin at predetermined time intervals. 5. Extract the active ingredient from the samples using a suitable solvent. 6. Analyze the samples using an appropriate method, e.g., HPLC, to quantify the active ingredient. 7. Calculate the rate of absorption based on the amount of active ingredient permeating through the skin at different time intervals. 8. Document the testing procedure, including application technique, sampling intervals, and analytical methods. 9. Prepare a report summarizing the rate of absorption test, including results and observations. 8. Rate of drug release test. General methods before growth. 1. Small amount of ointment is placed on the surface of nutrient agar contained in a petri dish. After a suitable period of incubation, the zone of inhibition, C, is measured and correlated with the rate of release. 2. An alternative method is to smear internal surface of test tubes with thin layers of ointment. Fill the tubes with saline serum and after a gap of time estimating the amount of drug present in serum saline. 9. pH measurement principle. pH measurement ensures the product's acidity or alkalinity falls within a specified range, which is important for stability and skin compatibility. Procedure: a pH meter or pH indicator strips are used to measure the pH of the product. The product is mixed with water if necessary to create a homogeneous sample for testing. 10. Viscosity test principle. Viscosity testing assesses the thickness and flow characteristics of the product, which are crucial for application and product performance. Procedure: a viscometer or rheometer is used to measure the viscosity. The product is subjected to controlled shear stress, and the resulting viscosity is recorded. There are 3 types of viscometer. 1. Brookfield viscometer. Measures viscosity by applying rotational force to a spindle in the sample. 2. Ostwald viscometer. Measures viscosity by timing the flow of fluid through a capillary. 3. Falling ball viscometer. Measures viscosity by timing the fall of a ball through a liquid-filled tube. 11. Dye test. 1. The scarlet red dye is mixed with the cream. 2. Place a drop of the cream on a microscopic slide, then covers it with a cover slip and examines it under a microscope. If the dispersed globules appear red, the ground colorless. The cream is OW type. The reverse condition occurs in water and oil type cream, i.e. the dispersed globules appear colorless. 12. Water content. Test principle. The water content test measures the amount of water present in a pharmaceutical product, which can affect stability and efficacy. Procedure: 1. Sample preparation. Weigh a known amount of the product. 2. Method. Selection. Common methods include loss on drying and spectroscopic methods. 3. Analysis. Perform the chosen method to determine water content. 4. Calculation. Calculate the percentage of water based on the initial weight and the amount of water detected. 5. Comparison. Compare the result with the acceptable limits for the specific product. 13. Spreadability test. The cream sample was applied between the 2 glass slides and was compressed between the 2 glass slide to uniform thickness by placing 100 g of weight for 5 minutes, then weight was added to the weighing pan. 2. The time in which the upper glass slide moved over the lower slide was taken as a measure of spreadability. 14. Uniformity of container. Principle. The uniformity of containers test ensures that each container in a batch holds a consistent volume or weight of the product, ensuring dosage accuracy and consistency. Procedure 1. Selection. Randomly select a specified number of containers from a batch. 2. Measurement. Measure the volume or weight of the product in each selected container. 3. Comparison. Compare the measurements against the declared volume or weight. 4. Evaluation. All measurements should fall within the specified tolerance range to pass the test. 15. In vitro release test, rate of penetration. Principle. The in vitro release test for semisolids evaluates how quickly an API is released from dosage forms like creams or gels, simulating its behavior on skin or mucosal membranes. Procedure. 1. Place semi-solid in a diffusion cell with a skin-like membrane. 2. Add a receptor medium, e.g., phosphate buffer. 3. Sample the medium at intervals to measure API release. 4. Analyze and plot the release profile. 16. Irritation and sensitization. Testing principles, irritation. Testing. This test assesses the potential of the product to cause irritation, which can lead to redness, swelling, or discomfort when applied to the skin. It helps ensure the product is safe for external use. Sensitization. Testing. Sensitization. Testing checks if the product can cause an allergic reaction, also known as sensitization. This reaction may not occur immediately, but can develop over time with repeated exposure to the product. This test ensures that the product is not causing skin allergies. 17. Packaging integrity principle. Packaging integrity tests. Check if the packaging effectively protects the product from external factors like light, air, and moisture. Procedure. 1. Conduct a visual inspection of the packaging materials for any visible defects or damage. 2. Perform seal integrity tests to check for proper closure and seal quality. 3. Evaluate container closure integrity to prevent microbial contamination or ingress of gases. 4. Test the compatibility between the product and packaging materials. 5. Subject the packaged products to environmental conditions to assess their protective capabilities. 6. Perform accelerated aging studies to evaluate long-term stability and integrity. 7. Document procedures, testing methods, and results, and provide recommendations for improvements if needed. Resources: Handbook of Pharmaceutical Manufacturing Formulations, 2nd edition. Thank you.